Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. So the topic for today is, does Ozempic or Wegovy cause stomach paralysis? It's very topical and I see this in a lot of tabloids. So let's delve into this particular question. So what's stomach paralysis? The medical term is gastroparesis. That means paralysis of the stomach. That means there's a paralysis of the stomach movements. In fact, it could also be the intestines. So the stomach starts to move less without any obstruction. So the food is stagnant in the stomach. So the patient may feel, or the person who's on Ozempic or Wegovy and has symptoms such as pain, abdomen, bloating, constipation, nausea, vomiting, and if it's persistent, then there may be a chance of stomach paralysis or gastroparesis. So it's important that you seek immediate attention. So don't try to treat yourself. So if you've got any symptoms like nausea, vomiting, bloating, feeling full and not hungry, heartburn, abdominal pain, and constipation, diarrhea, and it's persisting, seek immediate help. So this could be gastroparesis or stomach paralysis. But what you need to understand is, it may not be just the medication. There are lots of other conditions and other medications which causes the same problem, that is stomach paralysis. So people with type 1 diabetes especially, they can get gastroparesis because of poor blood glucose control, damaging the nerves going to the stomach and damaging the autonomic nervous system that can slow down the movement of the stomach. So that is gastroparesis as a complication of diabetes. You can get this also in type 2 diabetes. So there are several other medical conditions like rheumatoid arthritis, spinal cord injury, viral infection, and sometimes this is not so uncommon even after any bowel surgery. So gastroparesis is a term used for any paralysis of the stomach or delayed emptying of the stomach without a blockage. So that is gastroparesis. So what are the medications which can lead to gastroparesis other than Wegovy or Ozempic? So codeine, which is a painkiller, that can cause this. Antidepressants, some blood pressure medication like verapamil and nifedipine, and hormone medication like progesterone. So we're not talking just about Ozempic or Wegovy, any glucagon-like peptide. For example, liraglutide, Trulicity, dulaglutide, all these are glucagon-like peptides. So Saxenda. So some are trade names, some are the chemical name. All these can cause gastroparesis. And similarly, mounjaro, it's not been reported, I've not seen any reports, but even that can cause gastroparesis. Now, all this was based on a large review, and it was published in JAMA, which is Journal of American Medical Association, in October 2023. So they looked at a random sample of 16 million patients from the year 2006 to 2020, and they looked at this big database in US and analyzed people within the database for nearly 14 years, picked up people who are on liraglutide, around 4,000 people are on liraglutide, the trade name is Saxenda, and 613 were on semaglutide, which is Ozempic or Wegovy, and 654 patients were on bupropion or naltrexone, which is another tablet. The trade name is 𝒐𝒏𝒈. While analyzing the research, they found that more people on glucagon-like peptide, that is liraglutide and semaglutide, that is Ozempic, Saxenda, Wegovy, had more side effects like gastroparesis and pancreatitis. So the lead author, Dr. Modi Sodhi, says that these complications are very rare, but as more and more people start to use this medication, it will come to light. So it's always better to have knowledge about this condition so that it can be immediately tackled. So as soon as you have these symptoms, which I mentioned before, nausea, vomiting, abdominal pain, constipation, diarrhea, bloating, heartburn, I would advise you to immediately stop this medication and seek immediate help. So what your doctor would do is, you would examine you and find out what is going on. It may be that by stopping the medication, the symptoms may go away and may get better. But if it doesn't, then your doctor will look for any kidney failure or liver failure. It may be coexisting, so they may do a blood test. They may look for any problems with the pancreas, so they do a blood test and a stool test. You may have an endoscopy, gastric emptying studies, CT or MRI scan. So that's the investigations you are likely to have. So always important while you're on this medication to make sure you're well hydrated. have small portions of food. So that helps prevent any of these complications like stomach paralysis. And if you've got diabetes, make sure your blood sugars are well controlled. So people who are planning to start Wegovy, or in fact even Mounjaro or Saxenda, please be aware of this complication, which is gastroparesis. Hope that's been useful. If you've got any comments, don't forget to leave your comments at the bottom, or even if you would like me to address any specific issue related to obesity, obesity management, or obesity related medical conditions, do let me know. Thank you.